you might have heard this past week the diagnosis, or not the diagnosis itself, but Justin Timberlake publicizing the fact that he is living with Lyme disease. And do you know anything about Lyme disease?
Kind of.
That
I
you
know
get
that
it from ticks.
We're gonna dive deep with the doctor. Yeah, you
Yes.
get it from ticks, and I guess it could be a really debilitating disease.
Extremely. I know two people in my life, in my sphere of friends,
Yeah.
who both live with Lyme disease, and it has taken them off the court, like onto the sidelines in life, work,
Yes.
100%,
Yes. On the
and
couch.
years, exactly. Brain fog, all kinds of other symptoms, and it is just it has been heartbreaking to see unfold, and both of them, suffered from a tick bite. It was a tick bite and the problem is if it's caught early, it can be managed, but if you don't have it, my understanding is if you don't get it diagnosed and treated pretty early on, it can be completely debilitating. Actually, on that note, let's bring in Dr. Eboni Cornish. Do we have her
There
via
she is.
Zoom? Hi, Dr. Cornish.
Good morning.
Good
How
morning.
are you?
We're doing good. Where are you joining us from this morning, Dr. Cornish?
So right now I'm joining you from Reston, Virginia, which is outside of Washington, D.C.
Thank you
I'm from
so
the
much.
Amen
So
clinics there.
it's a little later there. Thank you so much for joining us. Dr. Cornish is the medical director at Amen Clinics and a member of the executive board for the International Lyme and Associated Diseases Society. All right, Dr. Cornish, let's just start off by having you run us through kind of the baseline cliff notes of this disease. The extent of our knowledge is it comes from tick bites. If it's untreated and undiagnosed for a while, it can become very debilitating. Can you kind of give us more details on exactly what Lyme disease does and how it affects the body?
All right, so it is transmitted by a deer tick traditionally, but we also have research that it can also be transmitted by fleas as well. And there is an infection called Bartonella, which is Lyme disease co-infection that can be transmitted by a cat scratch. So it's an epidemic. We have hundreds of thousands of patients being misdiagnosed annually. And you alluded to the fact that if it's caught early, you can have a positive response to treatment. But the problem is, majority of patients, because we have controversy with standard testing, and the research shows that the test through LabCorp and Quest may actually miss about 40% of positive cases, that patients then transition to this, what we call a chronic Lyme disease, which is when it compromises your immune system, can compromise your brain, and like you said, brain fog, and it can be as severe as things like multiple sclerosis, ALS that I've seen in my office before, and debilitating. It can cross over from mom to fetus as well. And I like to look at it as our invisible illness, because patients with tick-borne diseases can look completely normal. They may not even have a rash, and their doctors might dismiss them. And unfortunately, that is what leads to that transition to more of a chronic, stealth, debilitating illness.
So you said that it could be missed. So in my, what I've learned about Lyme disease, now I know, they don't always cause a red circle around the tick bite. So sometimes you don't have the rash. And then my second part of this question is, you get a blood test done, how are they missing it? Is it just you don't have enough of it in your body to be detected as positive?
So a lot of people, less than 40% of patients recall having that traditional bullseye tick bite or rash.
Okay.
It can appear differently in different skin tones and melanin patients, but at the same time, it's not common. The majority of my patients, because I treat at Amen Clinic chronic patients, don't even recall having a tick bite or a rash at all. And at the same time, when we talk about testing, now we have advocates in my organization, ILAS, which is International Lyme and Associated Diseases Society, and it's 600 doctors from all around the world that are treating this complex chronic illness. And we know that the standard testing that we have with LabCorp and Quest it misses about 60% of actual cases because it was initially created just for, screening purposes. But as we've done more research, we've seen that there's a lot of discrepancy. And as a result, not because it's not enough in your system, it's because tick-borne diseases can lower your immune system. And those tests require a very strong and robust immune response. That's why they call them immune testing for it to be positive. And so the majority of patients who present to my office have already had a compromised immune system, have been misdiagnosed or dismissed from their office that, follow standard testing strategies, and that's what leads to the poor outcomes.
Okay, so what, if anything, needs to change here, Dr. Cornish? Does there need to be new testing protocol? Because 40% only, and 60% of folks who are living with Lyme, it's undetected even when there's a direct screening for it. This is a major problem.
Everything needs to be done. We need to have legislation so that tick-borne disease testing and more comprehensive FDA approved testing that's a little more sensitive, maybe 90 to 95% sensitive for detecting tick-borne diseases, are available and covered by insurance. We need to have more awareness. I know in my state in Virginia, we have legislation that was passed 6 years ago, that was led by an organization, NatCap Lyme, whereby if a patient comes to a physician's office in the state of Virginia and they have a negative Lyme test, their doctor legally cannot tell them that they do not have Lyme disease because there are discrepancies there. This is legislation. So this tells you how big of a problem that this is. There needs to be more funding for research in this disease complex so that we can lead to better treatment options and earlier detection. And there needs to be more training of doctors. I'm actually a trained physician and a fellow with ILAD, so I teach doctors all around the world how to treat and detect this illness because there are so many controversies. Even in the state of Illinois, I have tons of patients who are misdiagnosed because Lyme doesn't exist, quote unquote, in Illinois. I have patients from around the world, South Africa, Europe, that are misdiagnosed, from the South, because it's everywhere. People need to have more awareness, and that's why I like that patients and, celebrities are now coming out and sharing their story, because people will see that they're nebulous symptoms that can be, just fatigue, right? And you need to get some doctor that's looking deeply at your brain so that you know what's happening and that this disorder is treated.
That's what I was going to ask you, is what are the symptoms that people might be having that might be Lyme disease? Maybe someone at home that's watching this, what is is there like a five different things, maybe off the top of your head, different symptoms that are common with Lyme disease, because maybe they didn't know that they got bit by a tick, or like you said, it could be transferred by fleas. What are symptoms that people wouldn't really necessarily connect to Lyme disease that might be Lyme disease?
So I tell people to put Lyme disease on their differential diagnosis. Let's start with the basics. If you're walking around with fatigue or maybe some migrating joint pain, headache, some forgetfulness, those could be some nebulous symptoms that need to be evaluated and not be ignored. And that could be initial presentations of tick-borne diseases. But then if you go a little further, let's say you're having depression or anxiety or ADHD or other neuropsychiatric symptoms that aren't responding to medication, we know that it's published that tick-borne diseases like Lyme disease can cause neuropsychiatric symptoms. And that's what I specialize at here at Amen Clinics, where we look at that root cause of mental illness as brain health. And not only that, let's say you have new onset autoimmune disorders, or you might, like I said earlier, have things like multiple sclerosis, ALS, and people disorders where they're not giving you those answers, fibromyalgia, chronic fatigue. You need to get a workup, because if it is treated, patients get better and it's so rewarding. But if it's missed, it can have very devastating long-term outcomes for
There are two
patients.
people, Dr. Cornish, in my life who I think miss the window, and I think they would say this too, miss the early detection window, and they've been, one of my friends has been mostly bedridden I mean, I'm not exaggerating, years now. I follow her on social media. Once someone is diagnosed, what is the time frame in order, that window to get treatment, and what are the treatment options?
You need to get a treatment immediately, because you can start having, unfortunately, long-term symptoms within, if you don't get treated within the first 30 days or less. And there are numerous treatment options. We have guided guidelines that, traditionally when I was in med school, they told me one dose of doxycycline was all a person needed, or 2 weeks. But now we have other guidelines through ILADS which show that we treat clinically until a person is better. Now, that doesn't mean that you need to be treated with years of antibiotics or treatment, but you do need to have a good approach at not only suppressing this infection, but also boosting your immune system. So may that be herbal, may that be antibiotics, may that also simultaneously include lifestyle, dietary, and immune support, so that we can rebuild your body. And I mean, your story is so common of your friend, people who are bedbound and doctors just misdiagnose them as psych, or just say it's all in your head. Like, it can be treatment options, and that's why doctors who are trained on treating vector-borne diseases is where people need to go before they take subtherapeutic treatment and they end up with those severe debilitating symptoms that you're reporting from your friend.
Dr. Cornish, we're getting the wrap from our producers in terms of time, but practically speaking, if parents are watching this right now, they've got kids that run around in the grass, in the woods, what do they really need to know? And obviously for us too, what do we need to know to protect ourselves?
Or how likely is it that we're going to get Lyme disease from ticks? That's my question.
Oh, it's very likely, and it's
Oh.
very common.
Oh.
Very common. You need to make sure you're using your tick repellent, may that be DEET, pyrameth, or other kind of natural forms of treatment, wearing those long socks, doing your due diligence when your kids are outside of doing tick checks, no matter where you live, because it's always that controversy. Oh, Lyme is just in rural areas. It's all around the country. They just had an article in the Washington Post saying how it's present in Washington, D.C. Well, it's always been present there. So check for ticks, check for different changes in symptoms that a patient may have overnight. If you have flu-like symptoms in the summer, that's not appropriate. You need to make sure you're looking into vector-borne diseases, and treat your lawn, because that's huge. Tick repellents for your lawn and your animals as well, especially dogs, and other pets that are outdoors. So it's all about prevention and checking.
Really good
All right.
info. All right, Dr. Eboni Cornish, thank you so much for your time. Really, really appreciate it.
Good info.
And thank you so much for having me.
Yeah.